California health officials say those respiratory infections are on the rise. This does include COVID, RSV, and the flu. KTVU South Bay reporter LaMonica Peters live tonight in San Jose with more on those rising rates. LaMonica.
Mike, the numbers are not as high as they have been over the last 3 to 4 years, but health officials say the cases are continuing to rise, and people need to remember that these viruses are still out there.
The difference between now and 4 years ago is another respiratory virus has joined the mix of influenza, RSV, and now COVID.
According to the California Department of Public Health, respiratory infections are trending up, with a 4.8% increase in hospital admissions for COVID-19 in the last week. At the same time, hospital admissions for flu cases have risen 18.8%.
Of all three of those infections, the flu actually is the one that I'm looking at the most. COVID has started to rise, but it's really been influenza that's had the uptick in the last 2 weeks.
Dr. Gandhi says cases of RSV or respiratory syncytial virus have also been detected, but so far not as much as it was last year. She says older people tend to be more at risk for being infected.
This year is very unique. We have an RSV vaccine for people who are 60 years and older. That's incredibly important that we've never had that before.
Nationally, Dr. Gandhi says about 50,000 people die from influenza infections each year, and now COVID-19 has reached that same milestone.
So unfortunately, it's likely true that COVID is joining influenza to cause that number of deaths a year. But it is mostly in older people, and our rate of COVID booster vaccination is about 7% across the board and only 14% in older people.
Now, health officials are recommending that people over the age of 65 get vaccinated for COVID-19 as well as the flu, because they are most likely to be infected and most likely to have the most severe symptoms if they are infected. Mike?
LaMonica Peters live tonight in San Jose. LaMonica, thank you.